Hi folks, it's Mike Smith with The Competent Human, and today we're going to be doing something under the category of set a bone. I am not a doctor or a medical professional, so this is not training, this is merely information, and it's going to be sort of a product review and also pointing you in the direction of a really great institution called the Wilderness Medical Institute. They're part of NOLS, and they're training in the Wilderness First Responder, or WFR. It is amazing bang for your buck with being a responsible adult, as Jack Spirko would say. It gets you most of the way to an EMT without stuff like driving an ambulance or that kind of thing. So I'll do another review on or description on that course another time. But for today, I wanted to show you a neat product that they put out, and it is called the Wilderness or WMI Wound Prep Kit. And in it is a bunch of cool stuff, and if they sell it at a profit, I would be really surprised. And so we're going to go over how you use it today. Again, get some training. If you're a nurse, I bet you're going to know how to do this kind of stuff, and if you haven't seen this all in one pack, it's really cool. And so I'll put a link to that product in the description for the video. So what I'm going to do is pretend to get cut on my leg so that I've got both hands to put this thing on, and I'll walk you through how you actually do it. So you'll see a little red line that I'm just going to put in with the Sharpie. It might be a blue one. We'll see what I've got kicking around. So okay, stay tuned. All right, we're back with probably more than you ever wanted to see of my leg. So I'm going to draw in some kind of cut, like I was stabbing myself or something, and that is, for scale, it's probably 1.5 inches, 2 inches, something like that. And so with this, the guidelines for this one, as I remember it, are that you can be 1/2 inch deep and opened up 1/2 inch wide, and this is still okay to use. The guidance now is not to shave around an area, but to go ahead and give it a haircut. So I'm going to come in here and get what I can. The reason for not shaving anymore is that apparently you give sort of micro tears to the skin, and that's not helping you. So another interesting, while I'm doing this, another interesting thing that WMI advocates is not using a bunch of antibiotics, and the reason, and scrubbing something out really heavily, and not using a bunch of things like alcohol or betadine or that kind of thing, is that within the first few seconds of getting cut, your body puts out new cells that are really fragile that help to heal really fast. And if you kill them off by either scrubbing them out or using really harsh chemicals, you're not going to get the healing that you would otherwise. And I was really skeptical of this because I've always been a scorched earth kind of guy. And but my wife got badly cut recently on her palm, and I thought, well, great, I'll try it on you. And so there's the first item that I'm pulling out of here is some clean gauze, and so I just used it to brush that hair away there. And I see that I've got a little more. So, and I would totally sterilize these shears before laying them right on top of a cut like this. So get what you can out of the way there. So the next thing that comes out of the pack, and maybe I'll show you all the parts now so they all kind of make sense. Okay, there's what's essentially a primer, and it's this tincture of benzoate, and it is sort of the adhesion promoter for what I'm going to show you next, which is wound closure strips, and these can be awfully big. You might need to cut them down, and we'll do that in a minute. And then what comes next is this handy dandy Gore-Tex panel. And so what we're going to do is primer this whole area more than the size of this window, and we're going to figure out the best way to put the window on there. And then we're going to do the wound closure strips, get this thing all buttoned up, then we're going to stick this down. So unfortunately, this tincture of benzoate is a one-shot deal. It's in a little So I'm taking it out of this sterile envelope now. And, so you don't want to cross-contaminate that little cotton deal if you can. So I'm going to crack, let's see, you're going to see it in a second here. I'm going to crack that so there's glass in there that I just cracked. And now give it a little shake. And you don't want to get it in the cut if you can help it. It's not going to really hurt it. This stuff is just basically thickened up betadine. So I'm going to go all around here. So we can imagine if this thing were deeper, it'd be splayed out a little bit right now. All right, so I've got a pretty good coating right there. Probably overkill, but we're going for it. So as I was saying earlier, the guidance from WMI is to debride the whole thing, or debride depending on who you are, with clean water using a syringe. And like you can get them, well, it's like a, what is it, 10 milliliter syringe with a plastic tip on it, not like a hypodermic. So here I'm cutting these in half. I suppose you could save them for another purpose, but you need, and you can get those tincture benzoate things separately. So there's a little split right here, kind of like a bumper sticker or something. And so you can just pop them off like that. And tweezers can be super helpful here. And I would be wearing gloves if this were me or somebody else, but I'm just gonna go for it here. So this stuff is tacky by now and it just wants to stick on its own, but you can press it down and then you tug ever so slightly just to get this thing to close on itself, right? You want that loaded to hold that cut together. So I'll go every little bit here. And if I saw one place where it was particularly sagging, I would, you know, or leaking out, I'd go and hit it again. All right, there's that. And if I had more, you know, if I needed more, I've got the other ones here. All right, so that thing's pinched together a little bit. And so now I've got this Gore-Tex here. And so I'm going to pull it out, and I'm not going to goober my hands all over. I'm going to grab it by the edges. So here it is, and there's some instructions on the back, but it's pretty straightforward. This thing peels off, and you're left with a window. So here's the Gore-Tex on this side, and if you can help, I just touched where I probably shouldn't have, but over here there's no Gore-Tex. And so I'm gonna come like this, grab it on the edge here, and I'm gonna line this thing up best I can, and also like a bumper sticker, just try and drop it down and smooth it out all around the edges. And of course, if it's more humid or something and that tincture benzoate isn't tacky yet, just chill, wait a little bit. So I'm smoothing it all down. And it's Gore-Tex, right? So all the air bubbles come out. It's really amazing. So this allows your skin to breathe. It doesn't get funky. You can go in the shower with it. You can get wet if you're on a canoe trip, whatever. It keeps it clean. It keeps it the right temperature, moisture, all that. So, I was saying earlier, my wife really, actually my 2-year-old accidentally stabbed my wife is how it went down, and in the palm, and it was spread out quite a bit, and it was in her palm and on that meaty part right here. And I thought, boy, that's a big enough area where we could maybe trim this Gore-Tex and get it to sit nicely, and we did, and I figured we were in a safe enough place where I could watch it the whole time. That's another nice thing with this, is you can see how the wound is healing. And so I thought, boy, let's try this WMI non-scorched earth method of just irrigating with water. It was clean to begin with. We ran it under the sink. It was in the kitchen. And so We just got it fairly clean, did this procedure, but cut down this window a little bit, and she healed unbelievably quickly with no infection at all. So there wasn't a lot of contamination to begin with, but this was really borne out. So, okay, after you've got this done here, there's a, find the tab. Let's see, I'll get it a little more center framed here. So I'm just gently peeling back, because the whole key with this is the edges. Like, if you don't get, if the edges aren't tacked down nicely, it's not going to last very long. And that's another reason to get off as much hair as you possibly can. There we go. So I'll zoom in a little bit. In places where it wasn't quite down, I'm just pushing it down a little bit. All right, let's zoom in a tad. All right, so it's hard to see, but that's the outline of the Gore-Tex, right? Like this, in kind of a pseudo rectangle. All right, so you saw how that, and I misspoke earlier, it's the WMI wound pack. And again, I'll put a link at the bottom here. And it is $4, and it's an amazing deal for what you just saw. There's a lot of gear in there. So what I'm gonna try and do is take a picture of this every day for a week or so, and put that up, and you'll see how it does, and we'll see if I did a good job or not. I think your mileage may vary based on skill and the person who you're putting it on, and where it is, like if it's on somebody's palm or knee or elbow or face or I don't know where. So I think it can vary how well it works, but I think it's a really cool tool, and for $4 and not having to, I mean, you'll save that much in Band-Aids just dressing something, let alone the benefit that I see for healing. Hey guys, we're back. It's Mike Smith with The Competent Human. This is day 24 hours in, so day 2 of the WMI wound kit test here. And so it's, you know, not much drama yet. It's been through a shower and that's about it. So one thing I wanted to correct was that I screwed up in telling you guys how to, with a reminder that I'm not a medical professional. This isn't training. It's a great example why I say that, because I muffed it up. So what you want to do is place these in pairs, and I had forgotten that. So I don't know if this is going to stick or not, but I'm going to try and show it. So you first do, and it is going to stick. So you get the first one going, and you do the second one. You do them on opposing sides. You do them together, and I don't know, I'm going to try and zoom in here. You work them in opposition. So let's see. Can you see how the skin gets drawn together there? It's slipping, but I think you can get the point. So you place them in pairs like that, get the wound closed, and then lock them down, okay? So obviously this is on top of the Gore-Tex, and this would be before you placed the Gore-Tex down. And then you'd go off to your next pair over here, and then one over here, again going, this might get tricky. Pull that skin together and lay it down, and then you put the Gore-Tex on. Okay, so stay tuned, and I'll try and get this off so I don't completely wreck this test. All right, gang, check back with you in a day. All right, so I finally managed to kill this thing. I did a workout out in the mud and did 100 burpees into the mud on this thing, and that did it in. It's delaminating pretty good, and yeah. So I'm gonna go ahead and peel it here and see how it goes. The adhesion's still like Band-Aid, you know, level of ouch. Let's see if I can get off to the side. So I guess a little bit of dirt there from the very end from today, but 2 little ouchy follicles, but all in all really good. So that's the WMI wound pack. It works incredibly well. That test lasted a couple weeks, and yeah, what killed it was just really nasty. Yeah, it was I think I did 100 burpees in the mud, and it finally kind of started to go out. But if I had a reason to keep it on, I still would have. It was holding on really well there. So hope that's useful to you. I think get some training in it. I'm not a medical professional. This is being filmed in 2015, and as of right now, the 10-day Wilderness First Responder course from WMI is $700, and I think it's 70 or 80 hours of training. It's an incredible experience. The EMTs that were there said it was way more useful than an EMT cert for the everyday citizen and prepper kind of guy, and gal. Hope that's useful to you. This is Mike Smith with The Competent Human, signing off.